looked at from the experience of researchers. And so up until recently, little was known about the health system experience specifically about these partnerships. And so a group from the Integrated Knowledge Translation Research Network conducted a study looking at the experience and perspectives of senior health managers, specifically in health system organizations, with their experience with research partnerships with universities. And they put out a call to reimagine research. And so they have a lot of rich findings in this paper. I highly recommend it. But they identified kind of 3 key things around perspectives on research and its usefulness. So sometimes it's seen as unhelpful or irrelevant in organization decision-making, so it can be given low importance. So there's really a difference in understanding of what research is. Organizational stress and restructuring. Sometimes if someone leaves a position, then you have to restructure relationships. There can be a lack of infrastructure support for that. And the last one is around academic readiness, responsiveness and readiness to partner. And I think that this is the one that I followed most closely and understanding a little bit more. And so looking at the mismatch between researchers' interest with health system needs. They found that in this study, so a lack of researcher understanding of the context of the health system, sometimes lack of skills in participating in collaborative work. And so unfortunately, in this paper, they do outline some really stark examples of some inappropriate researcher behavior that greatly impacted partnerships and knowledge exchange. And so building on that evidence base, how can we start to address some of those challenges that have been identified in the literature and from maybe our own experience, and start to implement strategies at multiple different levels, from funders, health system and academics, through to individuals and teams in the health system. So I'm going to focus my conversation today more on the individual and team level strategies, but it's important to think, or encourage you to think about how we can move this conversation forward to address some of those higher level strategies as well. So distilling some strategies into kind of 4 key pieces. And the first is that we know that there's great importance to developing those positive ongoing relationships. And so in order to do this, I think we need to really focus more on research relationships, not necessarily project partnerships. And I think that Erin and Joanne will give a really good example of this in practice with the SCIP network, that is a focus on a research issue, a research topic, not one-off projects where we're pulling in knowledge users to address a small issue. In order to do that, actually developing infrastructure to support those partnerships. The second is a recommendation to adopt a practice of humility. So how can we reimagine the role of researchers with that focus on the relationship between researchers and knowledge users? And so when we practice with humility, we have a respect for diverse perspectives. We can try to understand each other's context and be open to others' views. So in this way, it's no longer seen as the researcher being an expert at the table, but instead everybody is bringing a different expertise to the project, and we're there to learn, listen, and respond. Another piece is creating co-creating value-driven work. So when we work in this way, how can we try to create strategies that respond to maybe some struggles in the health system and identify mutual gains? And the last piece is encouraging adaptability. So how can we be flexible as researchers and in the science piece, but still responding to the needs of the knowledge users and focusing on those service-oriented relationships. And in doing so, more of a generalist approach, less focused on, I do research on this topic and that is it, but more, here is my skills, how can I help address an issue in the health system? So these are all, strategies that I can rhyme out and list off on slides, that we know that putting these into practice and into action isn't always easy. We don't necessarily learn about these skills in graduate programs unless we're really lucky enough to work with a supervisor or in an area where knowledge exchange is the norm. And so there's a group of us that are writing about this in a book chapter, so stay tuned for when that is released, but specifically around how can we develop these non-traditional academic skills. And so we've conceptualized this as a process of learning about co-production or IKT knowledge exchange, observing it, listening, and then actually practicing those skills in the real world. And it's really a continuous iterative cycle of learning, doing, and becoming. So that's an overview of some strategies for knowledge exchange around the literature, specifically about how to become an effective research partner. But moving forward, how can we, where do we see knowledge exchange going, and specifically the science of knowledge exchange? So there's lots, I think, of different areas in the literature that are moving forward, but I'm going to talk about 3 for this presentation. And so the first is around making research relevant. And so, as I mentioned before, there needs to be more of a focus on being, service-oriented and responding to health system needs that make research relevant. I loved this tweet by Tricia Greenhall, March 20th, 2020. So I'm sure we can all think about where we were during those first couple weeks of COVID lockdown here in Canada. And what she's speaking to is that transfer and production problem that we often reference in knowledge translation. So when we're in crisis, and if we have those existing partnerships, we're able to ask the most relevant questions, and researchers can bring their skill set to the table, pull together the evidence, and work with the health system to develop and change policy. And so I think we're going to see a lot more use of these rapid review methods to respond to health system needs, and taking more of a multi-method generalist approach where we focus more on what skills researchers can provide to the health system to address a range of research questions. I think in doing that, we'll move forward focusing on developing research program relationships, maybe that transcend multiple sub-projects, not just one-off project partners. And when we do that, we're allowing for time to build and maintain the work, and hopefully see impact that will then lead to the next research question. I think in order to make research relevant, we also need to advance how we're doing evaluation. And so how can we advance our understanding of evaluation to do better quality and more useful evaluation for the health system? So what questions are we trying to answer, and what methods and approaches will help get us there? So if we use this type of focus, then we may be more adaptable and flexible and able to respond to health system needs. I also think that advancing the science of IKT and knowledge exchange is important moving forward. We know lots of proposed benefits, but how do we know what works and what impact it is having? And so how can we evaluate and build the science base for these types of collaborative research? And really, this is the focus of the Integrated Knowledge Translation Research Network, which I have on the slide here. And they are assessing, the relationship between collaborative research approaches and research use, and trying to identify best practices and conditions for conducting IKT and knowledge exchange. So there's a great series out of the BMC that highlights this work moving forward that I definitely recommend. And lastly, in order to make research relevant and apply these different evaluation methods to address complex problems, we really need to be trained to do so. And so the methods and the approaches that maybe I've mentioned the last couple slides, you don't necessarily learn these in your graduate training. And so most often in your graduate training experience, maybe you find a gap in the literature, and then we put our heads down, we do our work, and then have some form of dissemination activity at the end, whether it's a conference presentation, publication, or publishing your thesis. And so we don't often get the opportunity to learn or practice the skills that we need to work in partnership. And so how can we create environments and spaces for trainees to learn about health system context and the roles and expertise of all members involved in research, and really equip researchers with those skills to work in partnership? And so we took the findings from that National Health System Leader Study that I mentioned earlier and partnered with the CASPER Student Working Group to create a workshop on this topic that we delivered at a CASPER conference. And so this paper that I have here up top is just a summary of our workshop and reflections as facilitators on how to work collaboratively within the health system. And we're also conducting a scoping review that's being led by my Master's of Science in Nursing student, Danielle Shin, on research trainee experiences with co-production and research partnership approaches. So how are they using these partnership approaches in their own thesis work? And what can we learn from them to better equip future trainees in learning about how to do knowledge exchange and the science behind that? So with that, hopefully that's a fairly quick overview of the science behind knowledge exchange. And I'm going to stop sharing so that we can get to the good stuff around the practice.
Thank you so much, Christine, and thank you for being a trooper and carrying on while we fix those technical difficulties. Obviously, never a dull moment with Zoom. That was a great presentation, and I feel really set the stage for all the examples that Joe and Erin are going to provide when it comes to SCIP and the way that they do knowledge exchange and partnerships and collaboration. So we will wait till they share their screen. If anybody just wants to grab a stretch break quickly, and then we'll get started.
Julia, can you just let me know if you can see that okay?
Yes, you are good to go. So as I said before, we have Joe Parker here and Erin Aubrey, who are going to speak about the practice of knowledge exchange and SCIP, the Knowledge Mobilization Network in Halifax. Whenever you guys are ready, I can see your screen perfectly.
Great, thanks Julia, and thanks Christine. That was so fantastic, and I think really set the stage to get kind of the science behind it, and now we're going to talk about the practical side, so great combo. I also, like Julia did, just want to acknowledge that SCIP is based on the traditional territory of the Mi'kmaq, and we are very grateful to live and work here on this land. I wanted to start by just giving a bit of a background on SCIP, why we exist, and what we're funded to do. So we know that Canada is a world leader in children's pain research. There is excellent research happening across the country, lots of it right here in Halifax at the IWK's Centre for Pediatric Pain Research. And this research has revealed so many effective ways to treat and prevent and manage children's pain. But we also know from patients, parents, healthcare providers, and institutions that often that knowledge is not being put into practice. Children are still undergoing painful procedures without enough pain management. Some parents are unsure of what to do to help their children with pain, and health professionals tell us that they don't have enough access to evidence-based tools. So this matters because pain that's not treated properly in children, it causes unnecessary suffering for them. It can also be traumatic and a challenge for families and the health professionals who are treating them, and it costs the healthcare system time and money. We know that there are long-term consequences later in life for poorly managed childhood pain, including fear of needles, healthcare avoidance, and an increased risk of chronic pain and addiction. So this is an area that was obviously so ripe for innovation and needed a big boost in terms of getting the existing knowledge into practice and into the hands of the people who need it. So Christine mentioned this in her slides too, that there is this commonly cited stat that it can take up to 17 years for research to make it into practice. And this has traditionally been the case. And I think this is part of what we're here to talk about today, all the science and work being done to reduce that gap and reduce that delay, get the research into the hands of people who need it more quickly. Children's pain was a great example where there was so much practical evidence and it was just taking too long to get into practice. So this is essentially what SKIP is doing, is trying to reduce this gap. And I think, as Christine highlighted as well, COVID has really shown how quickly we can pivot and take action based on evidence when the right motivation and the resources are there. So SKIP is a great example where we've got some resources to really mobilize knowledge, and we're excited to share with you some of the things we've been doing. So SKIP is funded through Networks of Centers of Excellence initiative that supports networks to focus exclusively on knowledge mobilization. So any researchers in the audience will know that it's a great opportunity and a luxury to have time and resources just fully focused on mobilizing knowledge and getting it into the hands of the audiences that you want to reach. Not trying to squeeze it in at the end of the grant or off the side of your desk. And as Christine has shown, there's lots of great work being done in all kinds of fields to make sure that happens. But this was a really great opportunity and a unique funding opportunity through the NCE. Some other features of it is that it really encourages and requires collaboration across sectors between academia, industry, government, nonprofit, and this really pushes us to think outside the box in terms of how we approach knowledge sharing. Networks are also incorporated as nonprofits, so that means we operate as a separate legal entity, and we are governed by a board of directors. We are hosted by DAL, which is fantastic, but we are actually our own nonprofit organization. And finally, the initiative requires co-leadership by a non-academic partner. So I wanted to give a shout out here to our awesome leadership team, Dr. Christine Chambers, who is based at DAL, and then Doug Maynard, who's our knowledge user director. He is based at Children's Healthcare Canada. And Katie Burney is our assistant scientific director. She's based at the University of Calgary. So Children's Healthcare Canada is our co-leading organization. They're a national member-based organization. They engage institutions that are delivering healthcare across Canada. So that includes all of the children's hospitals in the country. So this partnership is so valuable to us because it connects us to those institutions and this whole network of stakeholders that are working in the healthcare sector. And our work is organized around these 4 strategic priorities. So these form the basis of kind of our framework, and we have key performance indicators under each. So we are focused today on kind of the practicalities, but I did want to just convey that, we are quite strategic and we have this underlying structure and accountability. We have a logic model and an evaluation framework. But within that, there is lots of room for us to be creative in how we achieve those deliverables and how we work with partners to meet these goals. So today we're going to focus on kind of the fun stuff, I think, because Christine gave such a great foundation of the science behind KT. Also wanted to just give a nod to patient engagement. This is a core principle for SKIP. This is something that is a foundation for us. So we're a patients included organization. That means that we strive to enact the Patients Included Charter, which we can send links to later if you would like to see it. But we work to engage patient partners in all of our work. And we've had over 80 people sign up to be SKIP patient partners, and they engage in activities from top to bottom in the organization. So it might be, reviewing resources, it might be speaking at events, working on tools with us, sitting on committees. We also have patient representation on our board of directors. So this is just like a core thing that we are doing in all of our work. It's really important. And then to further the collaboration, we have all these organizational partners. So we have more than 100 national and international partners. As I said, these span, nonprofit, government, healthcare, industry, startups, and they're representing a wide range of fields. We've got health, but also communications and technology. And this is really how we go about our work, collaborating with partners. This is the core of how we operate and how we work to get the knowledge out there. So we, the model and the approach to knowledge mobilization that we take is we don't want to be in the business of just creating one-off tools and trying to attract and build a new audience from scratch. Our scientific director often says, if you build it, they may not come. And so what we try to do is work with organizations that already have communities and audiences and networks that can use this knowledge and use their platforms to go to where the audiences already are. And this has been really effective for us in reaching so many different people in our different knowledge user groups. So that includes patients, caregivers, health professionals, administrators, and policymakers. So I was going to give a few examples of some of the different platforms that we use to reach those different audiences. As I think Julia hinted at, we often hear that the examples are kind of what brings SCIP to life. They help people really understand how it is that we operate. So buckle up, we got a lot of examples today. First one, we partner with peer-reviewed journals. We've done 2 special issues with pediatric and neonatal pain to reach a wide audience of academics and clinicians. We work with our co-partner, our co-leading organization to reach a huge audience in the healthcare sector through their Spark Live webinar series and their weekly newsletter. We're working with the Health Standards Organization to develop a new pediatric pain standard to be used in hospitals across the country. We have a partnership with the Conversation Canada, where we're developing a whole series of articles with helpful information and to raise awareness about children's pain. So that obviously reaches their enormous readership across Canada. And another key audience that we want to reach is parents. So we have this great partnership with Erica M's YMC, which is this amazing platform with a huge community for people go there for articles and blog posts and discussion around parenting topics. And so we partner with YMC on key campaigns, and that way we reach millions of parents through their platform, which is really cool. So our work is organized in a hub and spoke model, and this means we have 4 regional hubs across Canada. So here in Halifax, we have our Eastern Canada hub, which is led by Dr. Alan Finley at the IWK. So each hub has a scientific or clinical lead. That's who's shown here. We have another hub in Ottawa at Children's Healthcare Canada, one at Sick Kids Hospital in Toronto, and one at the Stollery Children's Hospital in Edmonton. And then in addition to the hub lead, there's also a knowledge broker at each site. So I am going to turn it over to Erin, who is our knowledge broker for Eastern Canada, to tell you all what a knowledge broker is.
Hi, everyone. Thanks so much, Joe. Joe, can you just give me a nod that you can hear me? Excellent, great. No mute problems so far in this webinar, which is shocking. I'm very proud of all of us. All right, so hi everyone, really excited to be here today. If you haven't heard of the term knowledge broker, you're not alone. It is definitely a newer term where a lot of people have been more acting informally in these roles, doing pieces of the roles kind of off the sides of your desk, and only more recently have organizations been carving out these specific roles for people. So knowledge brokers act as intermediaries, and they serve as change catalysts who are continually engaging with stakeholders and facilitating the execution of knowledge mobilization activities. Within our network, they support healthcare organizations within each of our regions, beginning with those that have the greatest readiness for change to access, adapt, and implement evidence. Our knowledge brokers, or KBs as we're also called, are constantly developing relationships with and between knowledge producers and knowledge users. So again, this is the knowledge producers, so those people that are creating that evidence, so those researchers, and then those knowledge producers. So I think, as Joe did say, but for SKIP, that's those patients, families, caregivers, point of care, so any healthcare provider, and then also those policymakers and administrators. So some of you right now may be all squinty-eyed, just like this guy, being like, so what the heck did she actually just say? So what I'm going to do is walk through some examples of the work I'm leading as a KB out of the Maritime region, just to give a bit more context to the role, and then hope that will make it come to life. The collaborative work I do as a KB can be broken down into 4 different levels within our network. So institutional work, local work, regional, and national. So institutionally, I'm working with the IWK leadership and clinical teams to support the organization's effort towards child-kind certification. Child-kind certification is a global standard that represents an institutional commitment to evidence-based pediatric pain management. This is a massive undertaking for an institution, which involves policy redevelopment, change management for new program rollout, engagement with stakeholders of all levels, including those of our youngest members of our IWK family, all the way to our C-suite level stakeholders as well. Pictured here on our beautiful whiteboard wall at our SKIP office is our strategic planning meeting we held in the middle of March, which actually was that faithful Friday the 13th, just before the world shut down, which I'm sure we all can remember, as Christine said, where we were during that point in time back then. For child-kind at the IWK and for pain management, there is a multidisciplinary committee that works towards meeting the criteria for certification site visit for child-kind, and I'm working collaboratively with them to support their efforts, these efforts. Once the IWK completes certification, we will be able to share our learnings and tools that we've created and processes with other institutions in the eastern region of Canada and also across Canada to allow them to better work towards certification as well. At a local level, SKIP has some really strong, exciting partnerships. For example, The Rounds. The Rounds is an innovative tech startup here located in Halifax. They have an incredible platform with thousands of healthcare providers from across North America. The concept is kind of like a Facebook for registered healthcare providers, which allows for privacy and confidentiality to be built into the interface such that clinicians can share case-based problems, questions, and allow for facilitated learning and problem solving together across the platform. SKIP has our own community on here, and we host virtual events like AMA events. And yes, we have been hosting virtual events for longer than just starting in March, last March because of the pandemic. But yeah, so we host virtual AMA events with key opinion leaders and knowledge experts where they share pain management tools and resources, and they can answer real-time questions from healthcare providers as they come in on the platform. This is a great example of what Joe touched on, of us not trying to create our own network or reinvent a wheel of a network that already exists. We can work with The Rounds and partner with them and tap into their incredible reach and network of healthcare providers they already have to disseminate our knowledge and expertise through that. So The Rounds is an obvious fit for SKIP for reaching some of our key knowledge user audiences with healthcare providers, but we also do some other local partnerships which may be less expected in the role they play in KM for SKIP. Volta, for example, is an interesting example of a partnership as they're outside the sphere of health and research. Volta, located in downtown Halifax, is a well-known Atlantic Canadian startup hub and co-working space. They provided us with a venue, an opportunity to host a world-class networking event at their amazing venue, which allowed us to tap into a broader range of stakeholders to network with and share our key messages when we launched our network last April. These types of partnerships are a hallmark of SKIP's style of collaboration. With a partnership kind of the breaking the mold of having a less traditional, not always academic partnerships, thinking outside of the box, thinking more private sector, startup. And I was joking with Joe that sometimes where SKIP is so far out of the box, so they're thinking the box can be a very, very tiny dot to us. As Joe mentioned, we are a registered nonprofit, and our partnership with the Halifax Chamber of Commerce has enabled us to have access to a supportive local business environment, professional development opportunities, and also tap into a really well-established network of local businesses. I will shamelessly celebrate that we did recently find out that Skip is a finalist for the Chamber's Halifax Business Awards for the Not-for-Profit of the Year. So that's pretty exciting. Regionally in Eastern Canada, we have worked hard to ensure that we're engaging with partners outside of our typical tertiary care academic center, with the lens to provide and lend expertise with the goal to transfer knowledge to community-based other facilities within our region and how they can implement successfully evidence-based pediatric pain care. This could look like a whole bunch of different things. It may look the way we work with Dr. Maureen Allen, who's a rural pediatric, she's a rural emerge and palliative care pain doc in Antigonish, Nova Scotia, who's a huge pain champion. So much so that she created her own podcast called Pain Talk. And so she reaches patients and healthcare providers and has important discussions about pain and uses this platform to disseminate important evidence. In Moncton, it could look like working with a local group there to support their organization to hold their first ever pediatric pain forum, which I will say is currently postponed, to bring experts in to disseminate knowledge across their province, and also how this project started from a request that came into us to better align their pediatric pain policies, ensuring that kiddos receiving pain care in a small town in New Brunswick will get offered the same care that they get in Moncton or Fredericton. At the Janeway in Newfoundland, we're also looking to support educational events to empower their healthcare providers in evidence-based pain management, and also transfer learnings that we have learned here at the IDBK with the IDBK's long-standing and incredibly successful interdisciplinary pain clinic model here. Finally, if anyone is a fan of Alex Colville's art, this piece at the bottom corner here is titled To Prince Edward Island, and it is a near replica of me looking towards PEI stakeholders in the coming years, as I'm really excited to hopefully have some conversations with you and learn about what's being done in your region as well. And so I will put another little plug. If you are from PEI on this webinar, I will leave my email in the chat, and I would love to hear from you. So at a national level, we have been working in a partnership with the Canadian Foundation for Healthcare Improvement, or CFHI, for just over a year now. So CFHI is a pan-Canadian organization that is a not-for-profit funded by Health Canada. Within our partnership, we work to promote, scale, and spread evidence-based pediatric pain management programs for health professionals and institutions across Canada. With them, we've done spread and scale workshops, a scoping meeting with a diverse group of experts that resulted in the creation of a bilingual opioids in our children executive summary. But more recently, as many of you or all of you can guess, that many care providers across the country have had to quickly pivot their service provision to accommodate public health recommendations, and virtual care has become a lot more common. So this gave us a great opportunity with our partnership actually with CFHI, as we decided to launch a call for innovations to find out what people are doing in virtual care across Canada, what's working, and what are we learning about virtual care across Canada. Innovations were reviewed by a merit review panel that included individuals with lived experience, experts in pediatric pain, virtual care, and health policy, with the goal to be able to share these innovations broadly and the learnings from each of them as well. Just yesterday, actually, at Children's Healthcare Canada's annual conference, which is happening right now, I'm just full of shameless plugs that's happening right now. You can hop onto that after this. We hosted a Dragon's Den innovation pitch style session where all the innovations selected by the Merit Review Committee were given the opportunity to present and further disseminate their work while looking for partnership synergies with other innovations, the experts there, and also session attendees. I don't know if anyone attended the session yesterday. I don't know if there's any overlap here, but we had one innovator actually sing a song. It was pretty amazing. So at a national level, with advocacy kind of across the board. We partnered with Senate Canada and did a Hill Day last spring meeting. Yes, in person. Seems like such a thing of the past, with politicians, with our patient partners in our network, and along with a bunch of other stakeholders to advocate for the importance of knowledge mobilization and evidence-based pain management in institutions across Canada. Adam, the young gentleman you can see in the photo on the left there, lives with chronic pain due to sickle cell disease, and he gave a compelling speech to senators at our visit. Senator Colin Deacon spoke actually about SKIP, the importance of knowledge mobilization, partnership, and evidence-based pediatric pain management in his Senate address, which was pretty neat to see. In a more typical knowledge exchange event, we did collaborate last winter to host a CIHR Best Brains Exchange. So these type of events bring senior policymakers together with researchers and implementation experts to discuss a high priority health-related topic of shared interest. So the collaboration within Nova Scotia was between CIHR, Research Nova Scotia, Nova Scotia Health, IWK, the Province of Nova Scotia Department of Health and Wellness, and we hosted an event titled Towards a Provincial Pain Strategy for Nova Scotia. Patient partners presented this event, along with speakers from Australia, the National Institutes for Health, Alberta, Ontario, and British Columbia, and the event actually ended up convening over 60 stakeholders within Nova Scotia, including CEOs from both provincial health authorities and the Chief Medical Officer of Nova Scotia. What was kind of neat is that Health Canada heard about the Nova Scotia Best Brains event that was being organized, and through the Canadian Pain Task Force, they reached out to SKIP and they actually decided to hold their Atlantic Regional Workshop, which is the picture on the right here, the day before to leverage the stakeholders being already convened by our Best Brains event. This allowed for synergies for additional attendees across the Atlantic Canada region and along with federal leaders that they were already planning to bring in as well. So this made for a very exciting pain extravaganza event-filled week for me in January.
Thanks, Erin. I actually know that every week is a pain extravaganza for you. So that is a lot of things, a lot of examples that Erin just rattled off, and these are just some of the things that she and Dr. Finley have been working on out of the Atlantic Regional Hub over the past year. It's amazing she's still standing, right? And there are similar initiatives and other unique initiatives happening in all of our hubs across Canada in their own regions. And today we just wanted to highlight some of the stuff happening here in the Maritimes because we thought that would be of most interest to this audience. So we've given lots of examples of how we work with partners to meet audiences where they're at and to amplify great work that's already being done. So of course, it's totally simple and straightforward to work with over 100 partners, no problems there. Okay, so there may be a few challenges along the way. I know in her talk, Christine gave a really great overview of some of the challenges in research partnerships in terms of, power differentials and differing interests and priorities. And those are really important. And we wanted to just kind of add on to that in a very practical applied way, some of the things to watch out for when kind of trying to do this in a partnership model. So the first question is, who's doing what? When you're working across multiple organizations and they each have their own unique structures and staffing setups, priorities, ways of doing things, there's always a real risk of things falling between the cracks or duplication of effort or misunderstandings about timelines or end goals. So clarity is super important in these relationships. And in some cases, you may want written agreements, work plans, other documents that really make it clear who's doing what are the roles, responsibilities, and timelines and deliverables for each organization. And we've also found it really helpful to have one kind of relationship manager for each partnership, who's the key point person for making sure that the project goes ahead.
Another possible pitfall is the trap of the one-size-fits-all thinking. So different partners will require different approaches. There's different organizational cultures or structures, as Joe mentioned. For example, if you're working with a really large established partner organization that has tons of processes and internal departments, their legal department may say, hey, we prepared a contract and an MOU, we're both going to sign this and then embark on this partnership. Whereas maybe a smaller organization may say, hey, let's try to do something small together, see how it turns out, which may be much less formal, but it still can be just as impactful. And again, similar to what Joe was talking about, the roles or responsibilities within different organizations may look differently. So a role you take on with one partnership may look completely different in another partnership. Another one is tunnel vision. It's easy, really easy when you are working in partnerships, and especially working with so many partners, to say, I work with this partner and they are a dissemination partner, or they're a patient organization and we do X with them and we don't do other things. And it's just easy to kind of stay in your lane and pursue that. But a good example of this actually is our partnership with CFHI that I was describing, that we were on a steady track working with them for probably 8 or 9 months or so to spread and scale established programs and building capacity at the institutional level to implement evidence-based pain management programs. Then enter COVID, and the landscape of healthcare delivery across our country shifted under our feet, and we were able to kind of step outside the work that we've been doing traditionally with them and pivot to some really exciting work, which was our call for innovations for virtual care that allowed us to work with more emerging innovations in brand new programs, which has been super fun and a great success, and just great to kind of tap into that new group of folks to work with.
And finally, the co-branding conundrum. You know, co-branding is a challenge even in the public sector. Everybody now has their own logos. People have their different preferences for language and terminology. Everyone has their own hashtags and communities and ways of doing things. And when you try to combine them, you know, there are often differences of opinion or challenges. So we've found that, you know, it's really important to stay flexible and try to balance what you most want to achieve out of a campaign or a tool or an initiative, and what will work best for the partnership. We think it's really important to have some kind of standards, or we've found this important to have, you know, guidelines that kind of say how we combine our brands with others or what we like to do. But in some cases, we have to throw those out the window and privilege the positive relationship going forward and making sure that there's an end result that everybody's happy with and that everyone's happy with the collaboration. So Christine also identified some really great principles and strategies for bridging the gap and power differentials between researchers and practice partners. And we just wanted to add on to that, you know, with some of our kind of practical suggestions here. Some of the things I mentioned on the previous slide, as this comic shows, you know, sometimes a miracle occurs and it just all works out. But in most cases, you need to be a little bit thoughtful and think about how to ensure that a positive outcome and a positive relationship are going to come out. So just the big takeaways from us are to be strategic and process oriented, have some things in place. One example we've been piloting is a new partnership pipeline, which is kind of a protocol, a process for onboarding new partners and working through the stages of a partnership toward different projects and outcomes. And as I said, having a relationship manager, but also being flexible to do things differently with different partners or on different projects with them. And, you know, thinking big, staying open to new possibilities, new ways of doing things. Different partners, including patient partners or organizational partners, will have new ideas, and it's great to be able to step outside and do something in a different way. And then, as Erin described on the previous slide, one size does not fit all. So sometimes things are going to be really formal and sometimes less formal. It's great to have the infrastructure and the things in place to use when they're going to be helpful, but also just to stay open. So I also wanted to put a little plug in for our Jump In with SKIP program. This is basically the service provision, service delivery arm of SKIP. We know that researchers are really great at doing research. And as Christine highlighted in her talk, the KT skills and the sensibilities for working in partnerships are not always part of the typical researcher's toolbox. So SKIP is trying to fill this gap by supporting researchers with their knowledge mobilization activities. So we do this through researcher consultations. We work with researchers to work through a tool where we help them develop knowledge mobilization plans for their studies, for their proposals they're putting in, develop budgets to go along with that. And then we provide supports for them in carrying out those plans, including access to our network, access to our different communications channels, support from our knowledge brokers, and some of those services we offer for free, but we're also available to broker some of the services, like we can do tool development, we can help with putting together media kits or strategies for patient partner engagement and things like that for researchers as well. So we're really excited about this program. We started piloting it in January. We've had a great response from researchers. So any researchers listening, if you're interested, reach out to us at the email address there.
And then just finally on the left here, we just have a snapshot of our activities over our first year. We are currently in year 2 of our funding, and you can find us almost anywhere online. So be sure to subscribe to our In the Loop, pun warning, monthly newsletter, and feel free to join in the conversation with us on social media. We can be found at Kids in Pain, and join the conversation using the hashtag It Doesn't Have to Hurt. Thank you so much for listening today. It's so exciting to see this great turnout for this event. We're happy to answer any questions, and always happy to chat more about what we shared today, whether it's here or offline after. So thanks, everyone.
Thank you so much, Erin and Joe. That was fabulous, and I feel worked so well with Christine speaking about the science of KT, and then you guys just popped in like every example that we needed for all those strategies. So it's like you almost planned it to be that way. So for those that are still online, we do have about 15 minutes for questions. What I ask is that if you have a question and you would like to write it in the chat box, you certainly can, and then I can ask it for you. If not, you can just write your name in the chat box, and then you can turn on your mic and even your video if you would like to ask the question. So Shelly's just putting up kind of the info I just said there. So I'll just give a few seconds to start out the discussion, and it can be for all 3 of the panelists, or if you have a specific question on the practice or science, it can be that as well. Okay, well, if no one's going to start, if we're a little shy. Oh, there we go. We have one there. In terms of NCE funding, how do you qualify for it? So I believe this would be focused to Skip. If Joe, would you like to take that on? Thanks.
Sure, I would. It's very unfortunate news that NCE has decided to sunset the knowledge mobilization program. So we were part of the last round of teams that were funded to do this, which is really too bad because it's an amazing opportunity. And it was quite a process. I wasn't with Skip at the time, but it was quite a process pulling together the application. They had to demonstrate so much support from partners in kind and really pull together a lot of assets to prove that they were going to be able to deliver this level of knowledge mobilization. So it was quite an achievement by Christine and her team, Christine Chambers, I mean, our scientific director, but unfortunately they're not doing this program anymore.
Thanks, Joe. So just while waiting for any questions to come in, I wanted to ask a question. This is for everybody to kind of talk about. For research teams that are usually can be quite small and often sometimes just a team of 1 when you're starting out, what would you suggest would be a knowledge exchange or IKT strategy to first start out with when you're really wanting to make those partnerships or you want to disseminate that knowledge? What would be kind of like your top 2 things that you would say, okay, this is practical to do?
Do you want me to go first? I can go first I'll give a researcher perspective maybe about how to kind of kick off those partnerships. And like you said, Julia, if it's just you getting started, you know, if you're a trainee interested in this, or an early career researcher, or maybe you're more senior but you're wanting to do more partnership work, the best strategy that I can recommend is just really informal conversations. I want to say go pick up coffee and stop by someone's office. You can't do that anymore, but something like that. So maybe it's a cold email to someone you're interested in partnering with and asking for a Zoom chat or a chat over the phone, and really just kind of start to lay the foundation for those relationships, because as Joe and Erin mentioned in their presentation too, those partnership relationships is what, you know, is the most successful, or will lead to the most success. So if you can start out early with informal conversations, getting to know the context of your partner's area, then I think that will just further develop into more conversations and maybe a project idea, and then you'll hit the ground running from there.
Thanks, Christine. Do you guys have anything to add?
Sure, yeah. I really appreciate it. I love, Christine, that you went to the practical, and now I'm going to go the other way. But there are some great tools out there that researchers can tap into. We have worked with Melanie Barwick. We can put the link in the chat. She has some really great tools for researchers to work through in terms of identifying who are the key audiences, like who could implement your research, who could take this knowledge and do something with it, and just to try to walk you through a process. And there are some similar tools. David Phipps at Research Impact Canada and York University, his unit there also has some great tools for researchers to work through and identify kind of some steps in a knowledge mobilization plan. Who do you need to connect to? And these are some of the tools that we work through in our consultations, in just helping people think about, like, where are those audiences and how will we engage them from the start?
I can just jump into, I think I was going to say very similar things to what Joe was going to say. I was going to say if there's access to a tool or tapping into one of the ones that Joe just mentioned, or like the free consultation. So whether that's something with someone like offering that Skip, or I know the MSSU also offers like kind of KT supports. Like I think just even if it's an hour free consultation, having a conversation to talk through like a topic that's new, or to walk through ideas and opportunities, especially really early on, just so then you can move forward developing your research program or individual projects kind of with that lens. And then similar, I think, to what Christine said about just having conversations. Like if you have an idea, I feel like it's Christine Chambers, when she built our network, I think it was a very different concept. It's not typical of what she would have normally done with her research program to engage all these different partners. And so I feel like kind of the sky's the limit. And if you think something could be neat, or you want to try something, like I would encourage you to like have that conversation, or see who at Twitter Canada or who at a startup or something you could have a conversation with to see what's possible. Just because I think, again, just because it doesn't need to be inside the box. I think being creative is really fun in this space as well.
Thanks, Erin. And I think all of you guys touched on, and I think Christine, you wrote it said it in your slides about how important it is to have partnerships outside of just projects, but just to have those connections and knowing what's going on. And I feel like that the whole idea of coffee or virtual coffee works really well. I have a question from Matthew Meaner here, and it's for Skip. It seems like Skip does a lot of things, capital on a lot, and has the fact that you are an independent, not-for-profit organization being a factor that facilitates your capacity levels.
That's a really interesting question, Matthew. I think it does to some extent. We have a lot of kind of freedom in setting our own, agenda activities. I mean, it's all, of course, based in our structure and what we're accountable to do with NCE, but we do have a lot of freedom to act creatively, and we are really lucky to be hosted by DAL, but at the same time, we are our own entity, so we can kind of set our own policies and procedures and things that are going to work for us. I think related to our nonprofit status, a big factor is our board of directors. We've got this incredible board of directors. They're really engaged and really diverse. And there's people who are like senior executives in healthcare leadership to patients and family members, everything in between. We've got people who are advocates, people who are in the business community, people who are healthcare providers, and influencers, and people who are kind of in the communication space. And they just really push us to think outside the box and to really think about what's happening in the world and in Canada that we can do something about, and how can we be responsive to that. So that's a really cool part of being a nonprofit, is having that guidance from this really diverse group. But I think probably the biggest factor in how we've been able to do a lot of things, I love your caps because, yep, it's a lot, is the number of partnerships we have, because they all have committed resources to SCIP. And so each of our hubs is based in a hospital that has committed resources to supporting having a knowledge broker there and having a scientific or clinical lead working on projects. And then all of our partners from the big to small have put in-kind or cash contributions to allow us to do different projects and different tools. And I think without, if we were trying to come up with resources to do all of those things on our own, it could never happen. But there's so many opportunities and so many great people who want to contribute. So
I think the only thing I'll add, and Joe touched on this too, is that I think the uniqueness of the NCE KM stream, like I think it seems like we can do a lot and we are doing a lot, but we're also really fortunate that we can focus on taking great evidence that exists by like very skilled and highly trained researchers who can just focus on that, and we can help them implement that and mobilize it into practice. And so it's kind of that concept of KM or KT that like people are really good at doing research and people love research, and it's sometimes hard to then expect an expert or a really highly trained research scientist to then become all of a sudden this media personality or this KT KM expert. So I think it's definitely a newer concept and a newer model, but I think even though the KM stream of NCE is sunsetting, I think it'll be really interesting to see what comes up, because I think this is like a very interesting and new invaluable concept, I think, for researchers, pediatric pain, but even beyond, to have this kind of KM KT hub to support and capacity build so that these researchers can focus on having their careers and looking into what they want to, but then having these supports from us.
Thank you both. I think this kind of piggybacks on a conversation we were having the other day about how important it is to value the position of anybody in KT, and how those knowledge brokers and coordinators and all of the work that goes into helping with that red tape, the administrative work, the coordination, like kind of the behind the scene things that happen with the challenges of collaboration and partnership, that it is really tough to play both of those roles. So I hope that even though that stream is stopping, that we'll be able to see something in the future. We have a few more minutes for questions if anybody has anything more to ask. If not, I will close off and give you guys back a few minutes of your time. Great. Well, thank you guys again so much for tuning in for the first session of Keeping Up with Knowledge Translation. I feel like it was almost an analogy of knowledge exchange, that it can be bumpy at the start, but it usually is pretty positive when it ends up. So this is going to be happening bi-monthly. So the next session is going to be January 21st, and it's going to be on science and practice of implementation. We are just confirming our speakers. Before we all leave, I just want to say thank you so much to Christine, Erin, and Joe for participating today. I learned so much as well about SCIP and science of KT, knowledge exchange specifically. I feel like no matter how much you know, you can always learn from different perspectives. So thank you again, and I will give you back about 3 minutes of your time today.
Thanks.
Bye, everyone.
Julia, thanks everyone.
Bye, thanks.